Okay, thanks very much. So that's the title, yes. So Steve cannot be here, unfortunately, but if we keep things low in the technology format, you will see at the end of some of your rows, I can just about see a few of them, you might have to fling them around to each other, but what I think would be good is if you can have those questions you may well have wanted to direct directly to Steve if he were here, if you can note some of those down, what I will do is take those away and I will link up with Steve and perhaps also link up with Linda Sanders, who you would have heard from earlier, who is the director that I work for in City of Wolverhampton Council, and we'll try and get some responses that are more about that from that strategic level. So there's no doubt, having been around and done a lot of work with different local authorities, obviously I do know how things were positioned. I've got a view as to how things could be done, but also some examples you'll see today that have been kindly provided from different local authorities around the country. But obviously, I myself am not necessarily a strategic thinker. So it'd be, if you have anything that you would like to be able to ask questions on, as I said, there are post-it notes dotted around at the end of each row. Feel free to note some questions down and leave them at the end. Obviously, whichever you feel appropriate, you can ask. And also, obviously, my email address is at the end. I'm happy to take any questions, and I will respond to all of them. Hopefully, they're all about the subject matter and not something different, but there we go. So I'll run through a few things. I think some of these slides, as I say, resonates with what we've heard today. If you remember back to the initial sessions, there's a lot of talk about integration. Obviously, that's used a lot as a word. I'm sure you come across it on a day-to-day basis. But it's the how do we do it, and how do we influence our partners across health, social care and housing, and dare I say it, other public bodies such as the fire service, the police service, as well as working with home care agencies, voluntary sector, etc. It's more about the what's in it for me factor for all organisations. So integration is great. We can be pushed that way. If we had legislation, it would be even better. But a lot of it is going to be about the what's in it for me. Why should I do this? What do I get out of it as an organisation? Obviously, Linda Sanders was very clear in her point about people wanting a life, not a service. And again, conferences that you'll see around the country at the moment very much focusing on self-care. Self-care in itself, what exactly does that mean? We see people from a health point of view and saying, what do they think of self-care? From a social care world, a lot of the work that we're now doing is promoting self-care. It is about, in line with the Care Act, providing that trusted advice to people. And obviously there is that role, as we said, that connected homes and housing communities, etc. Obviously, you would have seen a slide very similar to this earlier, so I won't labour too much on some of the points. But I think we're all very clear. There's a huge wave already with us and coming around how do we support people that do want to live longer, as much as possible in their own home, as independently as possible. How do we facilitate that? The other side being, how do we support those that may care for them in both a formal and an informal environment to be able to look after them as effectively as possible? And sometimes that may well be people juggling a busy life of having a family at home, having a job that they may be fearful for, working a night shift. So again, increasingly, it's how do we use technology to play that role, to support people, not to take away human contact, but to add that additional support where possible. The challenge, I think, this morning we've talked a lot about the challenges that face health, social care, and indeed housing. But clearly, I'll be amazed if people around the room don't have these as some of their big hitters in the challenges they're faced. We all know that emissions are high into hospitals. We all know that delayed transfers of care are constantly on the agenda across social care in particular, or equally within the press. So how do we reduce avoid emissions? How can technology help that? How do we help to make sure that we deliver things as effectively as possible? How do we meet people's needs with, let's face it, a reducing budget, 31% over the last 5 years within social care? And most importantly, how do we promote that independence, but also choice and self-management? So objectives, particularly the bottom one, that robust community offer. Technology is a key component, but it's an enabler. So how do we use our community sector? How do we use, in some places, community agents, you may call them, or village agents? How do we bring those people to help share the messages, but also provide some of the informal care? Again, another slide you saw this morning. So how tech savvy are we? 82% said that technology has a positive impact on their daily life. Just three of the things that were picked out there. Again, Linda resonated the same things this morning. People feel it's getting easier to use technology. It is no longer thinking that actually it's either high-end in terms of cost or equally very technical. Increasingly, as whether you're commissioners of services, providers of services, whether you supply the technology yourself, there will be that view as to actually what is the end user's goal in terms of using technology. So that simple to use message that Bridget used earlier is very key. You use the example of a TV remote. How many people have got TV remotes in their home that they themselves cannot understand how to work because there's so many different buttons that, to be perfectly honest, you need a degree in something far technical, more technical than I can understand. Whereas lots of people say, actually, I just want simple buttons. Keep it simple for me. Keep it simple for me as a user. Keep it simple for me as a carer who has to actually try and tell the person I care for how to use this sort of stuff. But it will be increasingly embedded in people's everyday life. On the flip side, again, as was said this morning, over-reliance on technology can lead to potentially people losing contact with those they have in their everyday life. It can be that actually community spirit, whilst people may live in the same community, they may well not necessarily interact with people as much outside their front door if they're able to do things electronically. And coming back to that key message we've talked about, it is about enabling choice and control. Technology should be part of the solution. It should be thinking first. We do need to embrace a technology-first culture in our workforce. But if we focus on the outcomes, if we focus on the risks that we want to be able to mitigate, we then push a referral, let's say, through, and we look at actually what are the solutions that will meet the outcomes, rather than a prescriber-based model where we're just selecting what equipment we need and ticking through on a list. Similarly, when we ask people to self-refer, asking them about their everyday life, tell us your story, tell us the story of the person that you care for or that you're worried about, what do you want to achieve with this, and then services around the country should be able to provide that solution based on their individual needs. And I don't think that's aspirational, to be perfectly honest. I think most authorities that I've worked in, it's been exactly that path. From a strategic view, it's about obviously making sure we're thinking technology first. Whatever we do in our commission contracts, in the services we actually provide ourselves, technology at the heart of it. How do we make it simple for our workforce to be able to refer in, but knowing clearly that it's their role to refer, their role to identify the outcomes and the risks, and the actual services side to identify what is the solution. So that role of the AT Telecare resources in your local authority in particular is increasingly as much about providing that trusted advice and enabling self-purchase where applicable as it is about delivering services. Some of the examples we'll come on to is very much about that. How do we help people to get to the end goal of potentially just saying, just show me where I can buy some of this stuff, rather than perhaps taking them through a more formal statutory route of always of having a referral, potentially sometimes waiting for an assessment, then waiting for the solution to be put in. So, a big long list that we'll run through, but I think what for me stands out from this is there are lots of examples around the country, and I think at previous conferences and at previous events I've been to, we're always hearing about good practice examples. Who's done what? What's happened next? Obviously, we do need to make sure, but how did they get to that point? How did they get the decision to actually effectively have some resource and some funding to start delivering this? All these things cost money, and if we're talking about more cost-effective delivery, we have to have a starting point of funding from somewhere. It doesn't suddenly magically appear. So the bit that Steve would have talked about is looking at how Blackburn are just as similar as most local authorities around the country. They have the same sorts of challenges. Obviously, their demographics may be different for other local authorities, but their story or their journey is really about the starting point of a low base and how have they progressed through that, how have they engaged with different partners. So, as it says there, so that's how things are in Blackburn. Lots of people with more than 2 or more long-term conditions. They traditionally had a high use of residential care, a very low base starting point in 2010 of those receiving Telecare, and obviously a large-scale growth plan from that. But after that growth, it's then how do we make it sustainable? How do we make it that it isn't about getting the numbers up? It's actually about delivering sustainable results that we can demonstrate to our health partners as well as social care, as well as our lead members, to be able to actually, if we're doing this more smartly, how do we start to look at how we can invest, each of us, in a whole system change? So as I said, rapid growth for those 2 years. The second point there, which will come on later on as well, is key for me, is creating dedicated capacity. Having worked in a lot, maybe 30 or 40 local authorities around the country, some authorities started off rapid growth, had a team in place, and then felt, actually, all this technology is business as usual now. We'll step away all of the teams, and we'll just let people refer in as usual. They'll put it through to us. We'll then put the technology in, and at some point we'll review. And again, welcome to hear people's views around the room. for me, a lot of places I equally worked in the last few years are then moving back to say, actually, it isn't as embedded as we thought it was. It isn't as, as business as usual. We're still getting the same challenges coming through from our health colleagues. We're still seeing the same amount of people coming through. We're still trying to get re-aidment as embedded as possible. So actually, the resources we now need to be putting in place are small, almost gatekeepers. They're having the referral, they're checking it's correct, they're making the decisions on, if you want these outcomes, this is the solution we should put in. They are making sure it is part of a coherent approach with technology first. What they're not there to do is do all of the referring and assessing for everybody. So it's about having that role in the middle, but probably a little bit of a different role than it may have been 5 or 6 years ago, where it's very much about have people that just take things and push them through. We've got to make sure we don't go back to the days of a prescriber model where people are just shoving referrals through just to get the numbers up. It has to be very much still based on outcomes, and it has to have the user and their carers at the heart of it. It doesn't need to be a 20-strong workforce. It needs to be people that are those trusted advisors. And another point that keeps coming forward, performance management. So again, if we don't measure things, we can't manage them. If we can't manage them, we can't tell, well, actually, was today a good day or was today a bad day? Or what was our trend last month versus this month? It's not about saying, well, actually, this week we had 30 installations for Telecare, last week we had 25, the week before. What does that really mean? It's what outcomes we're achieving, but how are we using the data that we'll have in all of our systems, albeit in probably quite a few systems. How do we use that data to tell us something, give us the intelligence side? So we may be capturing data, but we're not necessarily doing the intelligence wholesale. So again, bit of carrot and stick. You must make sure you think technology first. You will be traced as to referrals you are putting through and what percentage of them led to a service being delivered. But we're not necessarily saying you must refer 10 people a week for Telecare, because then it becomes, again, back about the numbers games. Lots of places have piloted telehealth with mixed results. Quite often it has been looking at people at a high end from the health triangle point of view, people with high-end health needs. It's become very much a pilot, and certainly in social care, I don't think pilot is really a word that we use so much anymore. It's more about actually, is that the right thing to do? And more and more local authorities are moving to the lower end of need and saying, actually, if we give trusted advice for people to enable themselves, that would be better, and keep them at home for longer, and equally keep them away from our services potentially for longer until they really do have that need. So on the left-hand side, what did they do when they developed the Safe and Well partnership in Blackburn? Again, they had the whole system 80, they had the strategy across health and social care. Other examples for any of you that have worked in Staffordshire, very good example of how the County Council are working with a number of CCGs and partnership trusts to try and develop the role of technology. It is about the person and the tech. So again, a lot of things that I am hopefully articulating are on the left-hand side. Not everything works. I think that's another key point. It's not to say not doing something is the crime here. Trying something, if it doesn't work, then working out, well, what did we do wrong? What could we do differently? For people that use a technology solution in their everyday life, it won't stay with them forever. Some people move on as their needs increase. But having something that perhaps people don't get on with certain solutions, then okay, we move on to something else. But having it in there and having the first thought in your head being technology will get you on the track. Not thinking about it until it's far too late, well, it's more likely that people will not adopt the technology. On the right-hand side, a huge range of partners. Some of the examples we'll come on to are exactly the same. It is about partnership working, but it always does need leadership. And that's leadership both at a strategic level, but also having some of the doers, the people that actually get on with things, leading the way. So lots of places like Blackburn, like others, invested in a development role. Somebody that's keeping an eye on the new technology out there, but is also the one that is going to their colleagues in CCGs, in the health trusts, trying to energize people to come more on board with things, reporting into strategic directors to make sure that those messages are resonated at their level. But somebody that develops constantly, that isn't for me a short-term, couple of week project role. That has to be something about getting embedded and over time looking at what the next thing is and the next thing. What we do know from our colleagues in the NHS and health is very much that now we talk about STPs. A few years ago there were different plans. Those things are moving all the time. Digital is becoming the language of choice, particularly in health. In social care land, it's more about actually it's technology in the broadest sense. It could be a very simple, low-level remote control plug socket that saves somebody from tripping over when they want to turn the TV off at night because they don't want to spend money on seeing the red standby button. As much as it could be, high-end environmental controls within a supported living environment. But for me, when we talk more about technology and social care, it is that very much that breadth. Our colleagues in health do tend to focus more on digital, and we need to make sure that there's a place for all types of technology, particularly as they can support all types of needs. Some words from partners in Blackburn. I'll let you read through those. But it does show the range of partners that have, again, not only helped deliver this, but have also seen the value for themselves, the what's in it for me. And assisted technology, as again, most of you, I'm sure, will have transformation